Hi everyone, and welcome to the HealthWorksAI 2022 Post-AEP Analysis Highlights. In this short video, we'll cover the general overview of our in-depth webinar, which covered the key insights analyzing the CMS CPSC enrollment data along with the CMS landscape data. While this video doesn't cover everything, it'll certainly provide you the gist of the webinar structure and the various visualizations and cuts of data that the analysis deep dives into. Let's begin with the national overview. In October 2021, CMS released the landscape files, and we found out that the Medicare Advantage market has grown by 452 plans, and this is the first time since 2018 this number has fallen below 550. This drop in plan count is not a cause for concern and has not affected the growth trend in any significant manner. Now, should the plan growth drop again next AEP, this will signify the beginning of a plateau phase, indicating that the markets might be saturating, and the existing plans are slowly peaking in terms of plan optimization and value proposition to beneficiaries. But using only the enrollment data and landscape data, it's impossible to verify these claims. More importantly, we must note that each market is unique and does not necessarily follow the national trend. Next, let's look at how these plans have performed year over year in terms of enrollments. The two charts we see here showcase the total enrollment and net enrollment. The total enrollment is defined as the current enrollment in the month of January taken year over year, and the net enrollment is defined as the net gain in enrollments from December to January for the past 5 AEPs. Looking at the total enrollments, in 2022, the individual Medicare market crossed the 23 million mark and has been growing at a steady rate since 2018. When we shift our focus to net enrollments, which is defined as the enrollment gain from December 2021 to Jan 2022, we can see that this year there has been a slight dip in the net enrollments compared to last year. While we cannot pinpoint the exact reason, one possibility is that this AEP saw fewer switches from original Medicare to Medicare Advantage. Again, without additional data, it's impossible to back that statement with a high level of confidence. If you're wondering why the net enrollments for 2019 has fallen so much, it's due to the sharp fall of enrollments in the 1876 cost plan type in 2019. Next, let's look at how these plans and enrollments have been broken down based on plan description, namely whether it's a new plan or a service area expansion plan, etc. The charts we see here are a recurring visual in our report, and it shows us how the plans have been broken down based on their description. The chart on the right shows us how plan count has been broken down, and the one on the left shows us how net enrollment contribution for the same has been broken. 2022 saw 822 new plans being introduced. This number includes both new plans and initial contracts. This was a dip of 8.6% from last year, where 899 new plans were introduced. While a single dip in new plans does not indicate anything, should this pattern continue, then that would indicate that the market is stabilizing. Looking at the two charts, we can see that in 2022, nearly 15% of the plans were new and initial contracts. But this 15% contributed well over 50% of enrollment gain. A higher number of plans, or 18% to be exact, expanded into new service areas, but they contributed only 38% towards enrollment growth. This showcases the importance of new plans and initial contracts in the market, capturing more enrollments than any other segment. What we saw here was the national level plan and enrollment breakdown, a small snippet of our 2022 AEP enrollment outcomes and trend analysis webinar. The complete webinar can be found on our Insights page and is a more comprehensive analysis, deep diving into multiple cuts of data like individual versus group plans, MA/MAPD, SNP types, plan types, and cost factors. The analysis also has a special focus on HMO and PPO plans, where we break up these plan types based on premium segments and see how HMO and PPO plans have performed in the different premium segments. The chart we see here is one of the HMO and PPO deep dives, where we focus on how plan count has changed for the different premium segments. At an overall level, HMO plans have increased the total number of plans this AEP. But from this chart, looking at the year-over-year trend section, we can clearly see that all this growth was driven by the zero premium segment. PPO, on the other hand, grew in all segments below $50, showing us how less price sensitive PPO plans are compared to HMO plans from a payer perspective. The HMO and PPO breakup sections allows us to look at how these plan types have been focusing on new plans and initial contracts. One clear evidence on the performance of PPO is to look at the share of new plan towards total plan count. In every premium segment, PPO plans have a higher percentage of new plans compared to HMO. Now, as comprehensive as this chart is, it is only one half of the complete picture that focuses only on plan count. The enrollment chart for the same can be found in our report on our Insights page, which shows us how HMO and PPO plans behave, both from a total and a net enrollment perspective for each of the premium segments. But focusing only on a national level doesn't allow us to capture how each market behaves. To capture these trends, we need to shift our focus at a state level. When we think about the top states in the country for Medicare Advantage, we tend to focus on total enrollments as the determining factor. While this is a good starting point to evaluate potential shifts across the nation, in doing so we fail to identify emerging markets and instead focus on saturated markets with high populations. The heat map on top shows us which states had the highest enrollments in January. Unsurprisingly, California, Florida, Texas, New York, and Pennsylvania have the highest total enrollments in the country, a position they have held for a while. Though these states have a high number of eligibles, entering such saturated markets will likely result in tough competition and high marketing investments for most organizations. A different way to evaluate state-wise performance is to focus on markets with the highest net enrollments. Doing so allows us to identify markets that are growing the fastest and often indicates saturated markets with high population coupled with high potential. While this helps shorten the list of true emerging markets, it also has challenges, as these states are also typically highly contested markets with substantial competition. The heat map below shows the states with the highest net enrollment gain from December 2021 to Jan 2022. Texas, Missouri, Illinois, North Carolina, and Michigan were the top 5 states in terms of net enrollments this AEP. But the best way to capture active markets with high potential is to combine both these charts. Let's take the example of Missouri. As of Jan 2022, Missouri has a total enrollment of under 500,000, which puts it in the top 15 states in terms of total enrollment. Looking at the net enrollment, the state gained a little under 43,000 net enrollments. But combine the two, and we can conclude that Missouri saw nearly 10% of its total enrollment come from this AEP alone, making it one of the hottest markets in 2022. While these charts tell us how each state is behaving in terms of enrollment growth, it is equally important to know who is the top competitor in each state. The animation in this slide shows us how the top payers in each state has changed over the years. Humana and United Health have dominated the state markets in 2018, but fast forward to 2022, and United Health Group has spread its dominance, capturing most of the nation, while Humana has lost the top spot in a few markets. However, there are a few states that have not seen any changes over the years. While Kaiser in California seems like an obvious answer, Martins Point Healthcare Incorporated has been the top organization in Maine since 2018. There are also multiple Blues organizations like BCBS Rhode Island and BCBS Alabama that have maintained dominance over their state. These type of animations help us visually capture how an organization rises and falls. But again, it's very important to know that the focus here is total enrollments. Total enrollments can be considered as the cumulative effect of various trends over the years. To best capture current trends, we need to focus on current net enrollments. When we look at the top payers in terms of net enrollment, we get some interesting results. Let's take the case of California. Kaiser has maintained its dominance over the state for top enrollments since 2018. But this AEP, Scan Group captured the highest enrollments in the state. Centene is also a good example, which has captured the highest net enrollments in 8 states, showcasing the effect of its aggressive expansion. While large organizations like United Health Group continue to maintain its dominance over 19 states, many Blues organizations like BCBS North Carolina, BCBS Michigan Mutuals, and Blue Cross of Idaho Services managed to be a top payer in their states. Being able to visually dissect the landscape and enrollment data at multiple levels allows us to better capture the various year-on-year trends and get a deeper understanding of how the different markets behave when compared to national trends. While this video highlights some of the types of charts our report covers, the entire report with all the comprehensive visualizations can be found on our Insights page. We hope you liked this highlights video, and if you want to watch the entire webinar, the link has been provided in the video description. If you have liked this video and found it informative, feel free to like and share this video. And if you want to stay updated with all HealthWorksAI content on the Medicare Advantage ecosystem, subscribe to our Insights page at www.healthworksai.com.